Heart disease is the leading cause of death in the United States. And it's not just the US. Heart disease is a major problem in most places around the globe. So it's important that we understand the causes of this dreadful disease and what we can do to prevent it. Diseases of the circulatory system is a vast topic, but in this lesson, we will cover the most common and most dangerous disease, and that is the coronary artery disease. So without any further ado, let's get started. So you might be wondering, well, what is coronary artery disease? Well, to understand what coronary artery disease is, you have to know what coronary arteries are. These arteries deliver blood to heart cells. And this might seem strange to you, because you might think that the heart has an unlimited supply of blood, since it's the organ that's pumping it. But the heart walls are incredibly thick, so it's difficult for the oxygen to diffuse right through and oxygenate these heart cells. So coronary arteries are the perfect solution. Let me show you how they look like and where they're located on the heart. So here's a simulation of the heart, and the coronary arteries are shown right here in blue. Well, obviously they won't be blue in real life, but anyway, coronary artery disease is when the cholesterol in your blood builds up the inside of these arteries. And soon, this cholesterol buildup will be huge and it will block the artery so that the blood can't get through. The symptoms of this can range from anything from chest pain all the way to heart attacks. That's the overview done. Let's go into a bit more detail. Let me try to draw this out for you. So let's say this is your coronary arteries, okay? A coronary artery. And let's go ahead and let's draw the components that make up your blood. So let's say this is your red blood cell, and let's draw some white blood cells and some cholesterol, those tiny dots over here. And coronary artery disease actually doesn't start with the cholesterol. It actually starts with a little bit of damage in the coronary arteries. So let's say this area here is a little bit damaged. Okay, a little bit damaged. And what the cholesterol thinks is it thinks that it's a cool place to hang out. So all the cholesterol's gonna start building up on this damaged coronary artery. And the white blood cells want to get rid of this. So what they do is they follow in after the cholesterol and into this big cholesterol buildup. And let me just point out that this cholesterol buildup is actually called a plaque. Okay? A plaque. And when the white blood cells go into this plaque, it starts off this big inflammatory process known as atherosclerosis. And what this basically means is hardening of the blood vessels. So the white blood cells go and try to sort the cholesterol out, but what actually happens is a lot of them actually die. So the cholesterol can keep depositing itself in this plaque, and soon, and by soon I mean a lot of time, like decades, it becomes really, really big. And this is a problem because the blood needs to be able to move freely around the vessels. But if there's a plaque in the middle, and then it will be difficult for the red blood cells and all the other components of the blood to get through. For now, it would be pretty okay. But over time, and of course I mean a lot of time, this plaque will soon get really big. And this vessel will be completely cut off. So if you are in this position, you would be having serious coronary artery disease, and I would advise you should go to a doctor. And what makes coronary artery disease even more dangerous than it already is that it can lead to a bunch of other diseases later on in your life. So let's start with the least dangerous one, called stable angina. Okay, let me write that down. stable angina. And the reason it's called stable angina is because you can actually control the amount of pain you feel. You might be wondering, well, how can someone control their pain? Well, let me try to explain. Let's say that this branch of blood vessels are delivering blood to this part of your heart. This part of your heart. So when you're resting, when your heart rate is low, there's just enough blood to go past this plaque and into these blood vessels. So the muscle over here is happy. It's happy because supply is equal to the demand. But when you're exercising, your heart pumps twice as fast, well, nearly twice as fast. And so you need more blood, you need more oxygen to keep your heart going. And in this case, this gap is too tiny to let all that blood flow through. So it's too small. And in this case, this heart muscle doesn't feel really well because it's not getting enough oxygen, so it can't do its job properly. And this is what's called stable angina. So if you have stable angina and you're exercising, you get a symptom called angina pectoris. So let me write that down. Angina pectoris. And if you look at this word properly, angina is Greek for strangle. And many people often describe stable angina as if someone's strangling their chest. So pectoris is chest. So earlier when I said you can control your pain, what I meant is that if you stop doing exercise, you're basically telling your heart to do less work. And if you're doing less work, your heart needs less oxygen. So all of a sudden, the blood that's making its way past the plaque is just enough to supply the heart muscles with oxygen. So now you wouldn't be getting that angina pectoris system or a strangling in your chest anymore. Now stable angina is the least dangerous of the coronary diseases. And when things get much worse than that, you can get a set of diseases known as acute coronary syndrome. So let me write that down. Acute coronary syndrome. And acute coronary syndrome can further be subdivided into unstable angina, and heart attacks. So, heart attacks. So let's talk about unstable angina first before we move on to heart attacks. So unstable angina is, well, we talked about stable angina, and stable angina is when you get a chest pain when you do exercise. Unstable angina, you can probably guess, you get chest pain temporarily and you don't have any control over it. Why? Because sometimes this plaque can get ruptured, okay? And what that means is it cuts itself open, so there's a cut in it, and the blood is exposed to the cholesterol or the plaque material inside. And this starts to leak out, and what we get is something called thrombosis. And a thrombosis is basically a blood clot inside a blood vessel. And this happens because all the platelets inside the blood start going crazy and get attracted towards this plaque material, because plaque material is really thrombogenic, and thrombogenic means it attracts clotting, and the platelets start clotting over this plaque material, and it blocks the blood even more. And from here, one of two things can happen. So the ruptured plaque material, so let me go this side. So it's still attached on this end, but it's just ruptured on this end. So what it can actually do is it can flip back and forth like this. And when it's up, so when it's flipped up, it actually blocks the blood vessel off. So it cuts the blood flow off. And remember what we talked about earlier, when you deprive lower parts of the heart of oxygen, you get that Angina Pectoris symptom, that strangling in your chest. But when it's facing downwards, the blood can still get through, but only a little bit. But when it's flipping up and down, you can't control it. You're going to get that Angina Pectoris symptom for a little bit, and then it's going to go away, and then you get it again, and then it goes away. So if you have unstable angina, you can get chest pain when you're resting. You don't actually need to exercise. That's why it's different from stable angina. It's because this ruptured plaque material is flapping up and down. And that's why it's called unstable angina. You can never predict when you're going to get chest pain. So it's unpredictable. Unpredictable. So now let's move on to our final part of the acute coronary syndrome. So that's the heart attack. So what causes a heart attack? So let's go back to our ruptured plaque over here. And one of two things can happen. So the ruptured plaque can completely break off, like this. And it can float downstream and block off a smaller artery. Okay? And the process of it breaking down is actually called embolization. The other thing that can happen is that this plaque material can completely clot. It can completely clot and block off this blood vessel. And this is called a thrombosis. And when either of these things happen, so whether you've had a thrombosis or whether you've embolized, you've completely blocked off a blood vessel. So in this case, you blocked off this entire blood vessel, and in this case, you blocked off this whole artery. And you end up with something known as a heart attack. And this is serious because you completely blocked off the blood supply to a part of the heart. So this part of the heart that the blood vessel is going to die. And if you don't get yourself to hospital within 20 minutes, then that part of the heart is going to permanently die. And that's what a heart attack is. Now seems like a nice time to end this video. If you've enjoyed it, please subscribe and hit that like button. Bye for now.